The newborn period can be it's a wonderful time for parents. It's exciting, a lot of changes taking place. It can also be kind of scary with lots of questions, and that's where the pediatrician comes into play. I think having a pediatrician who you see on a regular basis for checkups is so very important. Specifically the newborn period, you hear the phrase, all babies do is eat, sleep, and need diaper changes. So I think I kind of like to phrase it like that. So with eating, you have to choose how you're going to feed your baby. And parents can either choose breastfeeding or they can choose bottle feeding. We certainly support breastfeeding here at the Baton Rouge Clinic. I think it's the optimal way to feed your baby. Initially, it takes some time for that milk to come in. Typically 4 to 5 days is average. And so you shouldn't get frustrated if those first few feedings in the first 3 or 4 days of life, the baby seems hungry. We recommend feeding on demand. So you want to breastfeed the baby about every 3 to 4 hours during the day and also at night, through the night as well. Once the milk comes in, things get a little easier. Certainly, I always recommend talking to your pediatrician if there are any other concerns that come up. There are pediatricians available and lactation consultants that can answer questions. In terms of how to know your baby's getting enough with breastfeeds, most newborns take about 2 ounces per feed in the first couple of weeks of life, working up to about 3 ounces per feed by a month of age. If you're a breastfeeding mom, though, you're not going to know exactly how much the baby's getting, and so they're monitoring wet diapers. A baby should have about 1 wet diaper for every day of life, and then monitoring stool patterns, making sure that the baby's having nice, soft stools. The pattern of stools can vary. The most important thing is consistency, making sure that those stools are soft and not hard and pellet-like. Sleep, typically babies are sleeping about 18 out of 24 hours in the newborn period, and that sounds like a lot of sleep, but you'd be surprised at how tired you feel. Even with them sleeping that much, they are pretty much eating around the clock, and it's not until they hit 4 to 6 weeks of age that they may start sleeping 5 to 8 hour stretches. And so, just be prepared it's not realistic to think that a newborn would sleep through the night. Safe sleep is very important in newborns. I think keeping the newborns in a safe sleep environment is very important. So we recommend sleeping babies on their back. Temperature of the house, ideally between 68 and 72 degrees is a good idea. Sometimes a light fan in the room, not blowing directly on baby, but to circulate air can be helpful. And the most important thing, not smoking around the baby. That can be very, very harmful in terms of risk for crib death, as well as risk for respiratory problems. Colic is another thing that can sometimes be very upsetting to parents. It typically develops around 3 weeks of age and lasts sometimes through 3 months of age. And so defined by unexplained crying that's lasting more than 3 hours a day. Typically in the evening hours, we're seeing the crying. And so if your baby has colic, I think it's a great idea to talk to your doctor. I think getting a good routine exam to make sure that the child doesn't have ear infection or urinary tract infection or something else going on. If your doctor does determine that it's colic, certainly there are formulas that can sometimes help reduce crying time. And then patience. I think having other caregivers to come in and relieve you because you're going to be a frustrated, tired parent is a good idea.